Welcome to the anatomy series, starting with the anatomy of the heart, focusing on pericardium. So this session will go over the basic layers of the pericardium, in addition to some of the disorders that you can see in the pericardium. So let's first start with the pericardial anatomy. So the pericardium has layers from outer to inner. It has the fibrous pericardium, which is the very tough innermost layer, has some connective tissue and attaches to great vessels at the top of the heart, all the way down to the central tendon of the diaphragm at the bottom of the heart. This is also connected to the breastbone by ligaments. This figure shows also some of the myocardium, which including the endocardium, myocardium, and epicardium of the heart wall that is underlying the pericardium. The parietal layer of the serous pericardium, which is the next layer, is that outer layer that's firmly attached to the fibrous pericardium, and it does provide extra support. Next to this is the pericardial cavity, or the space, and then next to that is the visceral layer, the serous pericardium. This is the innermost layer which directly covers the heart and also has a portion of it covering the heart. That portion covering the heart is also known as the epicardium. The pericardial space is that space between the parietal and the visceral pericardium. It normally can hold up to 50 milliliters of serous pericardial fluid, which can then reduce the friction within that pericardium while the heart is contracting and relaxing. It's really designed to lubricate the heart and prevent scarring and inflammation. So now let's think about what can go wrong with these four layers, or with these layers of the pericardium. So the first one is pericarditis. And this is that inflammation of that pericardial area, not including the space necessarily. It can be acute, but can also be chronic. The four main types, the pathologic types, are fibrinous, which is the most common, and this is where fibrin deposits on the pericardial surfaces. The serous pericardium can also be affected. This is known as serous pericarditis, and this has minimal inflammation, but a lot more fluid in that layer. Purulent pericarditis is known as is usually due to bacterial infections. So there's pus in that pericardial fluid that is increased in that space there. Hemorrhagic pericarditis is where there's bleeding, usually from a malignancy that infiltrates the heart, and it can also inflame that pericardial space with blood. So moving on to the space between the fibrous and serous pericardial layers, we have two main things here: pericardial effusion and then really large pericardial effusions that cause cardiac tamponade. The first pericardial effusion, that's just accumulation of excessive fluid in the pericardial space. Remember that you only have 50 milliliters of fluid typically in this area, up to 50 milliliters. When that number goes much higher, usually around 300 to 500 milliliters, that can cause significant, or it can impede the relaxation and contraction of the heart. If that effusion gets very large, usually around 700, 800 milliliters, even as high as 2000 milliliters, this is going to be now called cardiac tamponade. This is now compressing the heart, so it interferes with cardiac function and the ability to pump the blood. And you can see that in this diagram, as that fluid increases, eventually can lead to obstructive shock and then death if it's untreated. Finally, we'll talk about constrictive pericarditis, and this is a little bit different. Instead of the space, now we're looking at the pericardium itself. It gets very thick and scars, and that becomes fibrotic. Because it's fibrotic, it's now not able to, it's very stiff on the heart, which doesn't allow the heart to constrict properly, contract properly, or fill properly. So this leads to a very dense fibrous tissue that can be very calcified, and it forms adhesions between the layers of the pericardium. So this concludes the pericardium session for anatomy of the heart. Please subscribe to the ACM YouTube channel for further updates and to access other content.